Good morning, good afternoon, and good evening, depending on where you are in the world right now. Ladies and gentlemen, dear colleagues, welcome everyone to this digital event, Trusted for Health, Pharmacy Medication, Adherence and Communication, an event organized by the International Pharmaceutical Federation, FIP. Adapting and expanding on the theme of the World Pharmacy Week, Pharmacy, always trusted for your health. We would like to welcome you to this webinar and learn more. And today we will learn about the role of pharmacists in improving medication adherence and communication. And this event has been sponsored by an unrestricted educational grant by Pfizer, who are with us here today. Thank you so very much for your kind support. And we are delighted to have you all with us today to learn more about pharmacy, medication, adherence, and communication. And adherence is a key component and closely linked to the vision of FIP, a world where everyone benefits from access to safe, effective, quality, and affordable medicines and health technologies, as well as from pharmaceutical care services provided by pharmacists in collaboration with other healthcare professionals. We have a very exciting program for you today, where we will take you through the different areas of today's topic. Poor medication adherence has risen as a serious health concern in the recent decade, and pharmacists can play an important role in medication adherence through many different strategies we have seen during the COVID-19 in particular. I'm really excited to have you all with us today. Next slide, please. We have that one, yes. It is my pleasure to introduce you not only to FIP, but as we walk our way through this topic, we will understand the importance of this issue for getting the best out of a medication as an investment in health, because a medicine is actually an investment in health. So let's go through some housekeeping rules as usual before we start today's event. This webinar is being recorded and live streamed via YouTube. The recording will be available on the FIP website at www.fip.org. And you may ask questions using the questions box provided. And you're also welcome to provide feedback using the email address webinars@fip.org. And I encourage you to become a member of FIP. You will find all the details at our website. And for your information, a certificate of attendance will be sent to all the attendees after the event. So next slide, please. I am here today with my colleague, Sarah Dining-Griffin. But before I hand over to Sarah, let me introduce myself. Perhaps some of you know me already, but for those who don't, I will introduce myself briefly. I am Lars-Åke Söderlund, and I'm a vice president of FIP and immediate past president of the community pharmacy section FIP. I have been working during my entire career with the Swedish healthcare sector, as well as with other health systems abroad, in improving health and creating a sustainable healthcare system by integrating pharmacy into primary healthcare. Recently, I've also for a number of years been vice president of the Swedish Pharmaceutical Society, as well as president for a national project, Check My Medicines, a project which has significantly improved the therapy and outcomes for thousands of elderly in Sweden. It is now a great honor and pleasure to be with you today, and I will now hand over to my colleague and co-host, Dr. Sarah Dining-Griffin from Australia. Sarah, the floor is yours.
Thank you, Lars. Welcome, everybody. My name is Dr. Sarah Dining-Griffin. I am a university lecturer at Charles Sturt University in Australia, as well as a community and accredited medicines review pharmacist. I was recently elected to the Community Pharmacy Section Exco of FIP. I am Vice Chair of the New Generation of Pharmaceutical Sciences Special Interest Group of FIP. I work with the Young Pharmacists Group of FIP, and nationally I am the Vice President of the Pharmaceutical Society of Australia's New South Wales branch. So it's really great to be moderating with you, Lars, for this session, and I'm really looking forward to hearing from our panelists and speakers. Back over to you.
Thank you, Sarah. Can we have the next slide, please? The event outcomes of today's session is that we want to use the time we have with you to discuss the role of pharmacists in medication adherence and communication, to share some regional and global thoughts on the common communication gaps and challenges that are experienced in all patient-facing sectors, and to highlight various regional and global strengths, accomplishments, and success stories in terms of medication adherence and communication in pharmacy. Our president, Dr. Catherine Duggan, is unable to join us today at this very important event, but she wants to send a message to all of you. And the fundamentals of trust center around good communication, and good communication has been shown to lead to positive adherence to medicines. So the cycle of trust in pharmacists remains core to the patient well-being. Thank you so very much, Catherine. Closely linked to this event is the theme of this year's World Pharmacy Day, which we recently did celebrate. Trust is essential in healthcare, and there is a significant association between trust in healthcare professionals and health outcomes for patients. The good news, though, is that pharmacy is really trusted. Pharmacists are one of the most highly trusted health professionals in all countries. And this has also been most evident during the pandemic, where pharmacies were both essential and accessible for all, and here to supply medicines, give important advice about safe and appropriate use of medicines. Trust in pharmacies has increased as never before. And the following graphic shows the trust in pharmacy and pharmacies. And as you can see, pharmacy has been voted the most trusted healthcare professional in many countries, and especially in Turkey, United Kingdom, and recently in Ireland. Next slide, please. Our profession is based in many different areas and sectors. In fact, you can find pharmacists almost everywhere. Pharmacists are trusted as scientists to develop new and safe medicines, trusted as health advisors, as educators to deliver competent and caring professionals in pharmacies, where they actually help you to get the best from your medicines and to stay healthy. So it is very important for pharmacists to have all of these: positive relationships, competence and expertise, and finally, as a customer or patient, you want consistency in the services you get. Next slide, please. For today, we have four main parts of the agenda. First, setting the scene. Secondly, is the global perspective. And thirdly, we want to spend some time with our regional leaders in a regional roundtable, gaining some regional insights, get to know some of the problems, but also some of the solutions. And today is a day where we will learn a lot about this problem. And finally, at the end, of course, we will close the event. So let's move on to the next slide, please. Setting the scene. With the support of our colleague Farah, who is involved in the FIP regional teams and also the FIP development goals, we would like you to take an activity. I'm going to hand over to Sarah now so she can introduce you to the activity. Farah, can you please walk us through how we can use this slide and how we can engage?
Thank you, Lars, and welcome, colleagues. So we'd like you to go to menti.com and use the code that we've just shared in the chat box, 83014426, or the QR code, and we will be sharing your answers live on the screen. We'd like you to provide a short answer to the following question: why is trust between the pharmacist and patient important? We will give this activity 1 minute and we will show the results in a few moments. So we've started to receive a couple of responses, Lars and Sarah. We have to improve patient care, better health outcomes, optimal patient outcomes, all revolving around better health outcomes, mutually beneficial relationship, that is important, to get patient engagement in their therapy. It has to do with value, So no trust equals no value appreciated by the patient. Again, we have better outcomes. Sarah and Lars, any comments on the results that we've obtained from our colleagues?
Thank you, Farah. I think we have captured already many very important comments, and we will be able to share this later. But what we got here is evidence that pharmacy is trusted, and pharmacy is trusted as a gateway to the appropriate and safe use of medicines. Trust is fundamental to the role of pharmacists. Thank you so very much, Farah. I think we should proceed to the next slide. Farah, I can't see the slides. Here they come. Yes, thank you. Next one, please. So we have now come to section 2 of the event, where some of our regional colleagues will share their perspectives on adherence and today's topics. Our colleague Matthew Hung, consultant in pharmacy in practice development at FIP and clinical staff pharmacist at St. Mary's Hospital, Montreal, West Island, Integrated University Health and Social Services Center, will introduce us to a fundamental concept in utilizing pharmacy or pharmacist-led services to optimize medication therapy. Matthew will give us an overview of the following toolkits: Medicines Reconciliation, a toolkit for pharmacists, and Medicines Utilization Review Toolkit as part of FIP's global perspective. Matthew, we would also like you to highlight the contents and how these documents actually provides a framework for medicines use, review, services with the ultimate goal of optimizing medicine use and medication safety and improving adherence, and also how it is ready to be used directly or adapted to local practices. Welcome, Matthew. The floor is yours.
All right, thank you very much, Lars, and hi everyone, and happy World Pharmacy Week. So my name is Matthew, and I'll be speaking about medication adherence and how it's utilized in pharmacist-led services to optimize medication therapy. So let's get right to it. As we know, medication errors and drug-related adverse effects can cause significant harm to patients and place a burden on our healthcare systems. So at least 1 death per day is estimated to be caused by medication errors in the United States. More than 40% of medication errors are thought to have resulted from inadequate medicines reconciliation during transitions of care. And also the estimated annual cost of medication errors is an astounding number, so $42 billion worldwide. And these statistics, resonate with me particularly because, as we know, medication errors are largely preventable. Of course, there are challenges with resource availability and prioritization of services, but there are different services and mechanisms that can be put into place. We can also raise awareness and encourage more training and education to prevent medication errors and the harm that they can place, that they can cause to our patients. And I think that we, as members of the pharmaceutical profession, have really a critical role to play in mitigating these errors. If you could go to the next slide, please. So facing sort of this global health challenge, the WHO released their third global patient safety challenge, really focusing on reducing medication-related harm. So they titled their challenge the Medication Without Harm Challenge and released technical documents as well as promotional and educational material to really educate and raise awareness about the issue. Along the same train of thought, FIP developed documents to really advocate for the role of the pharmacist in reducing medication-related harm. And I had the opportunity to work on the development of 2 toolkits that really showcase 2 different services that can be used by the pharmacy team to really optimize medication therapy and ultimately reduce the risk of medication errors that can be caused to our patients. So the first toolkit that we published was on medicines use review. This was developed and published in December 2020. And we're actually working on a revision of this toolkit. We're working with experts and researchers and frontline clinicians from across from the different corners of the world. So please look forward to the revised version of our toolkit. And then a few months later, in February of this year, we developed our second toolkit on medicines reconciliation that was developed in collaboration with the community pharmacy and hospital pharmacy sections of FIP. Go to the next slide, please. Thank you. So these toolkits, introduce the service, present some clinical and economic evidence behind the services, as well as different suggestions on ways to conduct them. So on the left-hand side, you'll see sort of a screenshot taken from our toolkit on medicines reconciliation. We worked based on a paper that was published on medicines reconciliation by Jonathan Penn and colleagues, a really great paper where we sort of adapted the different figures into our toolkit. So here you can see that we describe the different target moments for medicines reconciliation, as well as the different patient groups who should be prioritized for this service. On top of that, we also included some template forms in both of our toolkits. They can either be readily used or they can be adapted according to your local practice. And we did include a specific section where we address medication adherence. So addressing different concepts when evaluating this. So things like how medications are managed, the use of medication aids, level of health literacy, because as we know, medication adherence is so central to all of these services. So these toolkits you can find readily online on the FIP website. And if you could go to the next slide, please. So here I am going on and on about these toolkits, but the point I'm trying to make is that, especially in the context of this World Pharmacy Week, adherence is really a fundamental concept to all of these services. If we don't properly integrate the assessment of medication adherence, well, then the services that we conduct, that we deliver, aren't done so in the most optimal way. And this can cause perhaps an increase in the risk of medication errors and of harm that we're causing to our patients, as well as increasing the risk of placing a greater burden to our healthcare systems. So let's take an example. Let's look at medicines reconciliation. Let's say that you're a hospital pharmacist and you're conducting the MedRec for a patient who's newly admitted to your unit. You're compiling the list of home medications so that you could compare it to the list of active admission medications and identify and resolve discrepancies. So in this case, the patient, let's say, was admitted for a stroke, and on their home medication list, you can see that they were taking aspirin regularly at home, as well as a statin therapy. But then when you're conducting your interview, looking at different sources, working with the community pharmacist, you realize that the patient actually is quite forgetful and hasn't been taking either of their medications regularly. And I think that sort of this little scenario illustrates really the importance of assessing adherence, because obviously if a patient is not adherent to their statin therapy or to their antiplatelet therapy at home and they develop a new stroke, well then that can change the entire treatment plan. So really assessing medication adherence, documenting your findings and communicating it with the treating team and working together to manage the patient and their health issues is something that's so important. And that goes to say that medication adherence really is fundamental in all of this. And I think that we as pharmacists and members of the pharmacy team, I think we're well suited, if not the best suited member of the healthcare team to really comprehend and assess medication adherence so that we're able to optimize medication therapy, reduce the risk of medication errors, and ultimately reduce the potential harm that can be caused to patients and the burden that can be placed on our communities. So I think that's it for my slides. Thank you very much for your attention.
Thank you so very much, Matthew, for your presentation. Being non-adherent is really a serious problem, and poor adherence to treatment of chronic disease has been described by the World Health Organization as a worldwide problem of striking magnitude. And a number of rigorous reviews have found that in developed countries, adherence among patients suffering from chronic diseases average only 50%. And in developing countries, the rates are even lower. So the toolkits from FIP are most valuable resources for pharmacists in this perspective. Our next colleague to enter the floor is our colleague Timothy Chen from Australia. He is president of the Social and Administrative Pharmacy section of FIP and professor of medication management and head of pharmacy practice and health services research at the University of Sydney. Tim will highlight the purpose and the findings from the publication entitled Use of Medicines by the Elderly, the role of pharmacy in promoting adherence as part of FIP's global perspective. We would also like you, Tim, to mention how this report is intended as a tool to promote the role pharmacists can play in tackling adherence issues to governments and other agencies. The floor is yours, Tim.
So good morning, colleagues. Good evening, colleagues, fellow pharmacists from around the world. My name is Tim Chen, and I'm the president of the Social and Administrative Pharmacy section and a professor of medication management at the University of Sydney. So it's my great pleasure today to say a few words in relation to medication adherence. I'm sorry I'm not able to join you in person today, so I have instead pre-recorded these few slides. So we know that medication adherence is defined as the extent to which a patient's medication taking behaviour and/or execution of lifestyle changes corresponds with recommendations from a healthcare provider. We also know that medicines don't work in patients who don't take them. So in fact, this was actually a quote from Charles Everett Koop, former Surgeon General from the United States, made approximately 30 years ago. So a couple of years ago, the FIP commissioned this report on use of medicines in the elderly, the role of pharmacy in the promotion of adherence. And this resource is a very important resource because it's designed as a document for use by pharmacists. It's also designed to be used by pharmacists to support their role in providing medication adherence services. We also know that there is evidence to support various medication adherence interventions provided by pharmacists, and some of these are summarised in the report. These include new medicine services, including education and counselling by pharmacists, face-to-face with telephone follow-up, repeat medicine services, which includes review, education and counselling of patients and their carers, and thirdly, the provision of dose administration aids. 4, systems for reminding patients to take their medicines as prescribed, and simplification of medication regimens. So these are all evidence-informed interventions which can be provided by pharmacists. The FIP report on medication adherence identifies a number of key components of medication adherence interventions for the elderly. And so we know that we require effective communication with patients and carers by all members of the healthcare team, including pharmacists. Secondly, we should make medication adherence services as easy as possible for older patients to take their medicines correctly. And third, we need a sustained effort to achieve medication adherence, acknowledging that optimal medication adherence is only achieved by sustained medication taking behaviour by our patients. And importantly and practically, please consider using this report as a tool to promote the role of pharmacists in tackling medication adherence issues in your practice and in your countries. And please consider using the report in discussions you may have with governments and other agencies in support of the role of pharmacists in providing medication adherence services. I thank you for your time today. Thank you for tuning in to this webinar, and best wishes for the rest of the webinar. Thank you.
Thank you so very much, Tim, for the summary of this most valuable report for pharmacists, how actually we can promote the role of pharmacists in tackling adherence issues. So our next colleague to talk about adherence today is Susanna Kosinova, lead for policy, practice and compliance at FIP. And Susanna will introduce us to how FIP is promoting adherence by supporting women as agents promoting responsible use of medicines. Welcome, Susanna. The floor is yours.
Dear colleagues, my name is Zuzana Kusinova and I am the lead for policy, practice and compliance at FIP. I will now shortly present about FIP's work around improving adherence and specifically by empowering women as agents promoting responsible use of medicines. I will start with providing a short background to women's role as informal caregivers. Women are often informal caregivers of family members and partners and assume responsibility for health in the household. They play a crucial and underappreciated role in providing healthcare to families and communities, especially supporting medicines intake as prescribed. They facilitate adherence to medications. The evidence reveals that health systems rely on women's contribution as important caregivers, but they do not adequately support women in this endeavor. There is strong evidence on the negative impact of caregiving on women if they are unsupported. Our pharmacy leader, Dr. Carmen Peña, first female president of FIP, was very vocal about this issue and wanted to find solution on how FIP and pharmacists can support women around the world. Under her leadership, in 2018, FIP published a reference document entitled Pharmacists Supporting Women and Responsible Use of Medicines, Empowering Informal Caregivers. It gathers evidence of informal caregiving roles women play that contribute to good health and disease prevention. It explores roles pharmacists currently play as agents of women empowerment. It draws examples and analyzes data from an FIP survey sent to member organizations on existing pharmacy interventions. It also shows results of a literature review to identify relevant topics across countries worldwide. As I mentioned earlier, women do assume responsibilities for health of their family. This figure depicts the important areas where pharmacists can support women with better care and use of medicines. This ranges from, as you can see, access to safe medicines through prevention, to access to information and improved health literacy. This can be directed to care for children, parents, but also future parents. Pharmacists can furthermore support women in managing complex treatments. As you can see here, many of these roles do improve adherence to treatment. Pharmacists have unique competencies that can be maximally utilized to support women regarding education, health literacy, and health promotion, leading to improved adherence to medication. The report highlights that there is opportunity for pharmacists to empower women caregivers, for example, by preventing communicable and non-communicable diseases, or adhering to pharmacotherapy as prescribed, supporting physical and mental health, and very importantly, promoting health literacy, so understanding the disease options. With the publication of this reference document, FIP has shown true global leadership in urging other professional, non-profit, and industry partners to come on board and be active in this area. FIP is providing a platform for discussion with various partners on this important topic, and also is inspiring national organizations to support female informal caregivers and bring the world closer to health for all. This document also serves as an inspiration for developing new services to address unmet needs. The report is available at FIP website and under the link that is provided on this slide. And with this, I will give the floor back to the moderator. Thank you everyone for your attention.
Thank you so very much, Susanna. This is an excellent report showing how pharmacists can support women as caregivers. It is now my pleasure, and it's delightful for us today to welcome three experts from Pfizer to the stage. Catriona Scott, Medical Information Regional Therapy Area Lead, Internal Medicine and Rare Diseases, and Mariska Lubbe, Senior Information Specialist, Pfizer Medical Information. And Catriona will introduce us to the confident communications in pharmacy, and Mariska will introduce us to medication adherence and the role of healthcare professionals. But first, we will have some introductory words from Gudrun Höbinger, Medical Regional Area Lead for Pfizer. Welcome, Gudrun, Mariska, and Catriona. The floor is yours.
Hello and welcome. It's a real pleasure to be with everyone here today, and for our partnership event between Pfizer Medical Information, our Partner for Better program, and the FIP. My name is Gudrun Höbinger. I'm the sponsor of the Partner for Better program based in Dubai, and together with my team, Mariska Lobe in the UK and Katrina Scott in Ireland, we are pleased to really have a great round of 30 minutes now of presentations. Pharmacists are a critical partner for Pfizer and for responsible medicines use, and we value and appreciate really your role in that. Through the Partner for Better program, we aim to connect with pharmacy associations at local, regional, and international levels. In fact, actually, we met first at an FIP event in the annual Congress many years ago in Dublin. And the Partner for Better program was created through an educational need voiced to us by a lead pharmacist in Kenya 5 years ago. And we are very delighted for this continued connection. Also, of course, we would love to meet you in person, maybe next year, maybe a year in a couple of years to come. You are so central to the health of our patients, to your local communities, trusted medicines experts, and you face significant challenges in your role. One of these we talk about today is effective communications and adherence and compliance. And at Pfizer, we're very, very fortunate to have a team of expert colleagues who are focused on these topics and related issues. And before I hand over to my two colleagues, I wanted to say a big, big thank you and shout out to our partners at FIP who helped put these webinars together. Catherine, CEO of then Carola, Farah, Lars, and all the further esteemed colleagues. Thank you so much. And over to Katrina.
Thanks, Gudrun. Hey, everybody. Today, as Gudrun has mentioned, I'm going to cover the confident communications in pharmacy and just wish you all a happy World Pharmacy Week as well. Next slide there, please, Farah. So the learning objectives I'm going to cover off today are, number one is to gain confidence within communication skills. Number two is to learn how to prepare for a work conversation. And number three, to get tips for communicating confidently, even when it's a difficult topic. And number four, have ideas on how to evaluate if a conversation has gone well and how to learn for what you would do for the next time. Moving on then to the next slide, please, Clara. So for the purpose of today, I'm going to cover the 7 C's of communication. So this first came about from a book published back in 1952, and it was actually the first textbook in the field of public relations, which introduced us to the 7 C's of communication. And as Matthew has previously mentioned as well with regards to adherence, there's a high cost for miscommunication, and this can also lead, as an example, to loss to follow up with appointments as well, and in the worst case scenarios, the loss of lives due to this. So it's our responsibility to ensure healthcare related comms are clear and effective. So for the 7 comms, I'm going to go through clear, concise, concrete, correct, coherent, complete, and courteous. And moving on to the next slide, I'll just go through a few more of the details with this. So with the 7 C's, as I mentioned, with clear, it's the objective here is to set out your goal. So this sounds like I'd like to talk to you about. And so to make sure that this is clear, you would be free from any assumptions and the information is given in a simple manner. For concise, the objective would be to be brief and be focused. So it would start like with an example of the main issue here is So make sure that it's accurate and to the point. For concrete, be specific and use facts. So facts and knowledge are extremely important in this area as well. So it would sound like 20 patients have been affected. So just to make sure there that you're aligned to the topic, you believe in the message, and avoid a communication until you have all the facts. Moving on to correct, then you check for errors, you use evidence. So that would sound like patient records show. So again, it would be true to the information, ensure they comprehend any technical terms, for example. So correct communication here would add to the credibility of the conversation. For coherent, you should make sure that you'd be logical, focus on the main topic, and omit any extraneous information. And this would sound like also relevant is. So at coherent as well, you believe in the information that you are sharing, focus on the main topic, and make sure that it has a logical flow. For complete, include all the information required, state your ask, and this would sound like, therefore, I think we need to. So for complete as well, make sure you're providing all the data to make sure it's sufficient to achieve your objective. And then lastly, with courteous, ensure that you're respectful to your colleagues and their time, and also to patients as well. So the key thing here, which sounds like, thank you for your time, when could we discuss further? So always be polite and respect other opinions and point of view. Next slide there, please. So with the first activity, when you're preparing for this, of how we can use the 7 C's to prepare. Next slide there, please. They're just some prompts that I'm going to cover. So the key ones are, what is your objective? Who is the best person to talk to? And the way you prepare for the conversation as well. Make sure you have the evidence and what you might need to have an effective conversation. Do you need to book time to speak to this person properly, depending on if it's the patient or another healthcare professional? Do you need to lay the ground for the conversation as well? And do you need any allies ready to support you as well, depending on the topic of the conversation, if it is a sensitive topic or a difficult topic to discuss? Are you clear about the outcome of the conversation as well? And the next slide there, please, Farah. And with the conversation itself, how can they help during a conversation? And moving on to the next slide. The prompts here will be, where will you talk to the colleague? So make sure that it is, if it's needed, if it is a sensitive topic, that it is a private area or you've booked an appropriate place to have that conversation. And actually the allotted time as well. How long do you need to have this conversation? And what verbal and body language cues can you use? So you have with the language, there's open questions. Or is it going to be non-verbal communication, depending on the conversation or where the conversation is taking place? And make sure that there's a calm and considerate tone as well. And remember as well that visual is 55% of the conversation, vocal is 38%, and the vocabulary will be 7% to make sure it's effective conversation. How can you show that you are actively listening as well, which is actually quite a hard thing to manage as well, especially in today's environment when everybody can be preoccupied with a lot of other things that are going on. Next slide there, please, Farah. And then with the reflection, how do they help you evaluate the conversation? And the next slide again. So the prompts here are summarizing the recall. So just to make sure you're providing a summary or 3 key points from your conversation, asking politely for information recall or the key points, just to make sure it's clear from the two-way conversation that everything that's being covered is clear for both parties, and also the paraphrasing. And then you'll finish up with the reflection, and then just to make sure that there's a follow-up and an agreed follow-up with the action points from that follow-up. And the next slide, I think that's it then from me. Yes, thank you very much for your time, everybody.
Good morning, everyone. Thank you very much for this opportunity to present to you this morning. So I'm Mariska, and I'll be going through medication adherence and the role that healthcare professionals can play in this. So medication adherence, as you know, non-adherence is a common problem and can lead to disease progression, complications, premature death, lower quality of life, and higher healthcare costs. So today we're going to explore how you as a healthcare professional can help increase medication adherence. Next slide, please. So Pfizer has a long-standing commitment to working with patients and healthcare providers, as well as advocacy groups, to improve the lives of patients through our putting patients first philosophy. We have also created and provide many materials and information to help patients and healthcare professionals learn about the many factors that impact medication adherence and therefore increase positive patient outcomes. Those are healthcare professional focused materials and also patient focused materials available on Pfizer.com. Next slide. So for today, our objectives will be to define what medication adherence is and also looking at its impact, understanding reasons for patients' non-adherence and how it is also relevant in your pharmacy or practice, exploring different techniques to assess and improve medication adherence, and using strategies to enhance medication adherence for patients in your practice or then in your pharmacy. Moving on then, we'll look at medication adherence and its impact. But before we discuss this, we need to understand, that's okay, you can leave it there. We need to understand that medication adherence is more than just taking your medication. In this presentation, adherence is used as an overarching term, as there are really 3 specific terms that are associated with medication adherence. And all of these 3 terms play a critical role in making sure that a patient understands how to take their medication to ensure the best outcome. The first one is adherence, and this is the patient's ability to follow the provider's recommendation with respect to dosing, timing, and the frequency of the medication. So that's the actual act of filling their medication. And compliance is how well the patient follows the instructions on how and when to take the medication. And persistence is defined as how well the patient continues the medication regimen. And then moving on. So in this presentation, medication adherence has been defined as the extent to which patients take medications as prescribed by their healthcare providers. And on the slide, you can see some statistics on medication non-adherence. So non-adherence rates are about 50%, which is quite high. So that means approximately 1 in every 2 prescription doses is not taken as recommended by their healthcare provider. Secondly, primary non-adherence rates are about 22 to 28%. So that means that prescriptions are never filled by 22 to 28% of patients. And primary and adherence decreases over the first year of therapy. So meaning that approximately 1 in 4 patients will discontinue therapy by 12 months. I guess the most surprising here as well is that healthcare providers are often not fully aware of patients' non-adherence. Next slide, please. So in this slide, we're looking at the prevalence of non-adherence and its impact on healthcare. As you can see there, for every 100 prescriptions written, only 50 to 70 of these make it to the pharmacy. Only 48 to 66 leave the pharmacy, of which these only 25 to 30 are taken correctly, and only 15 to 20 are refilled as prescribed, which is a really low number. And from this, it's quite then easy to see that medication non-adherence increases the likelihood of treatment failure. And poor adherence to medication regimens account for substantial worsening in disease, death, complications and hospitalizations, and increased patient and healthcare system costs. Some other stats are 125,000 preventable deaths each year occur in the US due to medication non-adherence. And in the EU, for example, around 194,500 deaths each year are due to misdosing or other types of non-adherence. And then the next slide. Medication non-adherence also has an impact on medical care costs. $100 to $300 billion are spent annually on avoidable healthcare costs in the US. And a report published in the UK estimated that $500 million per year could potentially be saved if medicine adherence was improved. In the European Union, non-adherence is estimated to cost 1.25 billion euros each year. And I found this quote quite impactful. It says the degree of medication non-adherence is so great, and the consequences are of such concern that more people worldwide would benefit from efforts to improve medication adherence than from the development of new medical treatments. Next slide, please. So in this next section, we'll be looking at the reasons for non-adherence for patients. And go to the next, thank you. So adherence is a multi-dimensional phenomenon, and it is really determined by these 5 factors and the interplay of these factors, of which patient-related factors are one of them. But the common belief that patients are solely responsible for taking their medication is misleading, and it most often reflects a misunderstanding of how other factors affect patients' behavior and capacity to adhere to their treatment. And if we go further, we'll start to look at the first factor, and that is therapy related. So things like the complexity of the regimen, how long will the patient be taking their medication, have they maybe failed previous treatments, is some of the reasons there. And next, we will see that patient-related factors can include forgetfulness, misunderstanding of the treatment instructions, maybe a fear of dependence on the medication, and a frustration with their healthcare professional. Going to the next one is healthcare system. And that could be poor reimbursement by health insurance plans, a lack of medication, lack of knowledge and training for healthcare professionals, very short consultations where there isn't really any time for the patient to discuss any issues with their healthcare professional, and a lack of patient education as well, to name a few. Going to the next is social and economic reasons. Poverty, illiteracy, a low health literacy, I think has been mentioned as well today, as one of the reasons, unemployment, unstable living conditions, quite a few reasons there. And then the last one we will be looking at is condition related. So what are the severity of the symptoms that the patient is experiencing, their level of disability, the availability of effective treatments. So those factors all play a role in a patient's non-adherence. So just maybe thinking about your own practice or in your pharmacy, have you noticed increased work time with a case or many dose escalations for the patient's medication and related complications? Could this be due to poor medication adherence? If you just click it again, thank you. So evaluating medication adherence really could save lives, time, and money. And when physicians or then any prescriber, pharmacists, wrongly assume that their patients have taken prescribed medications, they may make inappropriate medication and/or dosage changes, and this could then result in further complications and also suboptimal health outcomes. And then just going to the next section. So now we will be looking at strategies in how we can improve adherence. The next slide, thank you. What is really important is communication, and that's been the theme as well throughout the few presentations beforehand. So effective healthcare provider patient communication is really essential for improved adherence. So collaboration and shared decision making between the patient and the physician or the pharmacist is really critical for adherence. And then the next. So these are 3 steps that are necessary to improve medication adherence. So the first one is patient identification, improved patient-provider trust and communication, and then lastly, patient education and engagement. So we'll be looking through those 3 in a bit more detail. So patient identification, how to identify high-risk patient groups. And these groups may include patients with new prescriptions, patients with poor mental health, comorbidities or patients taking a lot of different medications, patients that have with medications and dose changes. Going on. Looking at improved patient-provided trust and communication. So it's really important to ask open-ended questions that the patient can answer, and that also that there is no right or correct answer. Questions can include, how does the medication make you feel? How do you think the medication is working for you? So it's also really important to create a blame-free environment. So to give the patient the opportunity to tell their story and to present their point of view without any criticism. The next is to really then follow up as well with clarifying questions. So communication and partnership in the medical visit is really important for the development of trust and also an accepting relationship between the patient and the healthcare provider. Questions you can ask here is, how does it affect your daily life? Tell me more. So it's really important to not investigate, really just be curious about the patient, about their life and their experience with the medication that they are taking. Next slide, please. So the essence is that patients really must believe that their healthcare provider is someone who understands their unique experience of being a patient, and someone who can provide them with reliable and honest advice. So it's been shown that adherence rates are nearly 3 times higher in primary care relationships characterized by very high levels of trust, coupled with the physician's knowledge of the patient as a whole person. The next strategy we are looking at is patient education and engagement. So the first two was patient identification, and then improving the patient-provided trust and communication. Patients must really understand what they are supposed to do before they can follow medical recommendations. So the patient's health literacy is really central to their ability to adhere to their specific treatment. There are some resources noted here on the slide on Pfizer.com, and we also have a health literacy module that is available on the P4B microsite. So the next thing is to really address the patient's concerns, and the third is to communicate the essential information. And then with engagement, it's really important to make sure that the decision-making for the treatment of the patient is shared between yourself as the healthcare provider and also the patient. The next slide, just going further into patient education and engagement. As I've said, it's really important to understand the patient's health literacy. So we need to understand what the patient's knowledge is. So how do they get the information, who they get it from, how they feel about something. So questions you can maybe ask is, you have probably heard about, how do you understand it? Or what is your opinion on? Next slide. So as I've mentioned as well, it's important to address patients' concerns and really discuss questions that they may have regarding their condition or their treatment. And this will really help you to better understand their beliefs and thinking process and also their needs. So don't assume, always ask questions, find out what you need to know from the patient by maybe asking questions as, do you have any questions about your condition, or you have probably read about possible side effects. Is there anything you would like to ask? Next slide, please. Really going hand in hand with this is communicating the essential information that the patient needs to know. Questions you can ask here is, would you mind if I share my thoughts about? As probably there is quite a lot of information that you need to relay to the patient. It can be an information overload. So it's always good to use these types of questions to ask them permission before you do so. If you just click again for can you just click one? Thank you. So things that you maybe want to relate to the patient could be the name of the medication, the purpose, the rationale for choosing it, the frequency of dosing, when it should be taken, how long it should be taken, and then also the possible side effects they may have. And then the last one on the education and engagement is really the shared decision making. So enhancement of patients' involvement has a positive effect on increased adherence. So studies have found that both patient satisfaction and patient adherence are enhanced by their involvement and participation in their care. So really when physicians and or pharmacists and patients work together and strive for mutual agreement, they both achieve higher levels of satisfaction with the treatment encounter. We've looked at the different strategies now, and next we'll be looking at how you choose a strategy that you will be using in your pharmacy or in your practice. So when improving adherence, practitioners should focus on patient-centered approach. So it's focused on the role of the medication in the context of the patient's daily life. And practitioners can enhance adherence by creating a blame-free environment, improving that trust between yourself and the patient, improving the health literacy of the patient and understanding what the patient's health literacy is, really making the decisions based on the patient's needs and also their lifestyle, doing the shared decision making, seeing if a patient maybe needs financial assistance, and really doing simplified treatment regimens. There's also a few reminder techniques that you can use to increase adherence, such as the use of written instructions, maybe involving a family member in the discussion about the treatment for the patient, and then frequent follow-up visits. So there's unfortunately no simple way to improve the patient's adherence. The intervention strategies are really complex and have to be individualized to the specific patient. So there's no gold standard really or specific guidelines that you can use. It has to be strategies that you develop has to be tailored to the unique characteristics of the patient, their disease condition, the treatment regimens, maybe their geography, the healthcare system in place, and medication access. So it's quite a lot of things to think about. It's not just one really thing that you can do there. And it's really important to understand the reason for the non-adherence and getting to the core of the problem, as this always saves time. Just going to the next slide. And this is just an example really of a checklist for a patient leaving a hospital. So obviously when people are discharged from hospital, patients do look forward for them, but there is a transition where in hospital, for example, they receive their medications from the nurse at the exact time, and they took it them. But at home, it could be different reasons why they can't take it as prescribed. And studies have shown that improving discharge planning can improve outcomes for patients. And the next, I think that's my second last slide. So really the take-home message here is that adherence represents really a major healthcare problem, as we've mentioned, and a lot of the other speakers mentioned as well. And finding effective ways to improve it may have a far greater impact on the health of the population than any improvement in specific medical treatments. And I think that is me. So thank you very much for listening. And there's just some further readings as well available from Pfizer.com.
Thank you, Mariska, and everyone so far for your presentations. They have been really informative, and I'm sure everyone in the audience is thinking the same. So we'll now move on to section 3 of this event, and I would ask all our panelists to turn on their cameras as it's time for our roundtable discussion. As we move to the next slide, thank you. So we have experts from all over the world, from all World Health Organization regions joining us for this event. I will now introduce them briefly individually. So firstly, we have Manjeri Garat. Manjeri is Vice President of the International Pharmaceutical Federation. She is Vice President of the Indian Pharmaceutical Association and Chairperson of the Indian Pharmaceutical Association Community Pharmacy Division. Welcome, Manjeri. Next, we have Victoria Garcia Cardenas. Victoria is the chair of the Pharmacy Practice Research Special Interest Group of FIP and is the senior lecturer in pharmacy at the University of Technology in Sydney. Welcome, Victoria. Next, we have Tamara Pero Zurilla from the Pharmaceutical Care Department of the General Pharmaceutical Council of Spain. We also have Warren Meek, who is an honorary member of the Community Pharmacy section and is president of C7 Consulting. We also have Pascal Salame, professor of epidemiology, Lebanese University in the Faculty of Pharmacy. And lastly, we have Mariette Eckstein, who is the global lead for advancing integrated services, which is the Development Goal 7, a member of the Academic Pharmacy section, Executive Committee, as well as a pharmacist and sales manager, Professional Development Officer from the Pharmaceutical Society of South Africa. Welcome, Mariette. Next slide, thank you. So how we're going to run this roundtable. So already we have posed a number of questions to our panelists prior to the session just now. We've received a number of written responses from some regions, whilst others will cover these responses live in this event by selected panelists. So our panelists have put a lot of time and effort into preparing their responses to share their insights, experiences and issues from different regions of the world, as well as possible solutions. So our aim in this event is to compile a document and send the file to all participants after today's event, demonstrating a regional perspective. So I would encourage all participants to post questions using the Q&A function. I see some of you already have, and speakers may have a chance to answer these by typing during the event. So firstly, we have a number of questions for our panelists. The first question is, what are the region's strengths and achievements when it comes to medication adherence and communication? Please feel free to elaborate by sharing a success story. Now we have two of our panelists. So first up is Manjeri Garat, and I'd invite you, Manjeri, to answer the question. Thank you.
Thank you very much, Sarah, and thank you, FIP, for this invitation. And the speakers before me, they have given excellent presentation and a 360-degree view about the medication adherence. And I'm here to represent the Southeast Asian region. And I would like to say that when it comes to medication adherence, rather than strengths, we have more weaknesses in our region. And when it comes to the, the adherence to the treatment in case of non-communicable diseases, we have seen various studies have shown that it is more than 50% of non-adherence, which we see commonly in our patients. When it comes to antibiotic usage, it is even much more. So the adherence issue is non-adherence issue is very, very common in our part of the world, unfortunately. Our strength is we have number of pharmacists and we have number of community pharmacies, hospital pharmacies, but their role is not yet carved or not yet developed to deliver the patient-centric services or person-centric services. So this is one of the weaknesses we have in our region. Also, the health literacy is an issue. And therefore, since the health literacy is not well established in the society, people have more of casual attitude and less understanding of the importance of taking the medicines, as well as the monetary reasons. People feel that the medicines are expensive, or they have some beliefs like it is like there might be side effects, and they just leave the treatment. So I have a few success stories to tell you, and one of that I would emphasize right now, and that is our study on the tuberculosis. As you know, in India leads tuberculosis I mean, unfortunately, we have more than 1/4 of the global burden of the world in India as far as tuberculosis is concerned. And one of the major reasons for developing the drug-resistant TB is non-adherence to the treatment. So we took an initiative to engage the pharmacist in the DOT program, Directly Observed Treatment Short Course program from the Government of India. And by engaging the pharmacist, we ensured that the patients are brought to the government treatment, which is well monitored by the pharmacist. And then more than 100 pharmacists who were well trained delivered the DOT services through the community pharmacies, and they treated 3,200 patients over a period of time. And there was the adherence improved significantly, and we stopped these patients from going to the for the default treatment and going to the drug-resistant cases. So this is like one of the success stories that we have, that pharmacists, when they are motivated, well-trained, well-educated, and when you develop the policies around it, a right ecosystem, pharmacists can play a significant role in improving the medication adherence. And the DOT program delivered through the pharmacies in India has very well demonstrated the same. So this is what I wanted to convey. But we need to work a lot in area of medication adherence. And I agree with what the colleagues from Pfizer have said. We need to work and train the pharmacists on those 7 C's of communication and much more. So the communication through the pharmacies is much inadequate right now regarding the medicine usage, responsible use of medicines.
Thank you, Manjiri. You've raised some very, very important points, and I might hand over now to Dr. Victoria Garcia Cardenas to share your region's perspective. Thank you, Victoria.
Thank you very much, Sarah. I feel honored to participate in this great event with great presenters and panelists. So thank you very much. I'm now going to focus on the Australian example, as there is no doubt that Australia has been one of the most successful countries in developing and evaluating new professional pharmacy services. Although there is a wide range of services which are remunerated by the government under the umbrella of community pharmacy agreements in Australia, there seems to be a major focus on medication adherence management. So, for example, the current community pharmacy agreement contemplates payment for a range of adherence services, such as dose administration aids, stage supply, med checks, or diabetes med checks, amongst others. So it should be noted that on top of these services, there are additional services which are privately funded through different funding channels. So, for example, the pharmaceutical industry or the patient himself. Examples of these services include the new to therapy or the compliance service. Although all these services vary in their objectives and complexity, there is evidence of the positive impact that they have from the clinical and economic perspective. So I'm going to share a success story. My research team analyzed data from the aforementioned compliance program in order to analyze the clinical and economic impact of this service. So just to provide an overview, this service led by Guildcare, owned by the Pharmacy Guild, targets non-adherence patients when a calculated medication possession ratio, which is a measure of adherence, is below 70%. So this triggers an alert on the dispensing system to offer a simple educational-based intervention aiming at improving medication adherence. So then a guided interaction between the pharmacist and the patient is offered, which includes identification of adherence barriers, engaging patients in a brief educational interaction, goal setting, and recording of the interaction. So we analyzed a total of 1,800 community pharmacies and more than 20,000 patient records of patients using different medications. So we observed an increase in adherence rates that range between 15 and 19% after the pharmacist intervention, with an estimated saving to the Australian healthcare system of $1.9 billion annually. Our results demonstrate that pharmacies are ideally placed to improve patient adherence and reduce the financial burden placed on the healthcare system due to this prevalent problem. So we believe that funding of medication adherence programs and services should be considered by policy and decision makers. Thank you.
Thank you, Victoria. And it'd be really great for you to share the publication if you can in the chat box if it is available. I'm sure everyone would be interested in reading the findings and conclusions of that research. So thank you. All right, next question, we might move on to question 2. So we have, what are the region's emerging threats and challenges in terms of medication adherence and communication? So I will invite our third speaker, Tamara, to answer this question. Thank you, Tamara. I'll hand over to you.
Yeah, thank you, Sarah, and thank you, FIP, for this invitation, and hello, everybody. According to my knowledge from here in Europe, the current organization of the national health systems is not adequate enough to meet the health needs of the population, mainly in chronic patients. As you know, the lack of integration between hospital, health centers, and community pharmacy has a significant impact on the care of the patients, who are seen several times through a year. The problem lies in that the information that these professionals have on the patient cannot be shared in many countries here in Europe. The approach to adherence requires a multidisciplinary vision that should begin with the GPs taking into consideration, for example, the simplification of the therapeutic strategy, and continues with the collaboration from the nursing profession, with a view to boosting the information that deliver the GPs. And at last, the community pharmacy that should perform a complete adherence management service by reviewing the dispensation, the use of the approved medicine, and their optimal management by the patient. And in addition, the sustainability of our health system requires a better reorientation toward the needs of these chronic patients. A reinforced collaboration among all the caregivers should also be considered, because the patient must be more empowered and more well informed as an individual, able to understand what's the best solution for his or her health problem. As you know, only when patient actively collaborates in his or her own therapy, health outcomes are achieved in terms of the therapeutic adherence. Sadly, I'm being honest with you, because very, very few health administrations here in Europe committed to the work of the pharmacists in adherence. For me, that's the main challenge, because there are only 2 European countries here, Denmark and Portugal, where pharmacies are remunerated for providing an adherence management service in community pharmacies. In other countries, that here in Spain, pharmacies that on a voluntary basis decide to learn and specialize in providing service do this for free. So in the long term, this is not sustainable. Finally, talking about the communication, there are other problems, such as the lack of fast and direct channels of communication between the different health professionals. In many cases here in Europe, electronic prescriptions are used as a telephone call. But since there is not an official channel, it's very, very difficult to set up an interactive communication from the community pharmacy to the prescriber. Sometimes, as you know, the prescriber may not be aware of the lack of adherence that a patient, because of the patient, usually withdraw the medication from the community pharmacy, but you all know that, like me, that this not means that the patient is taking the medicines.
Thank you, Tamara. I think you raised some really important points about integration, or that leg thereof of pharmacists within the health system, and communication, perhaps the impact or the potential impact that has on medication adherence. So thank you for sharing your region's perspective. I will now hand over to Warren Meek from the Americas to share his view. Thank you, Warren.
Good morning, and thank you everybody for attending, and it's great content that I see. Before I get into the specific answer, may I just take a couple of moments to say, so far we've heard something about ideas to improve the situation with adherence. In fact, some of these solutions don't cost anything. And so if you refer back to the things that Katrina mentioned, there's no cost in smiling. There's no cost in saying hello to the patient. Now, there are some other things that there will be a cost to the pharmacy or the pharmacist, and that is in time, training, and the resources to put into place that particular, I guess, solution. Another word that I've heard throughout the morning, in my case, morning, because the sun is just about up now, is about tools and toolkits. I expect that some of you don't have a toolkit. I expect some of you have a toolkit and the tools are just thrown in there and you know it's in there somewhere, but where is it? And then finally, some of you have a toolkit, it's nicely organized, you know exactly where every tool is. So think about how you organize your toolkit. My last comment before answering the question is everything in life is 80-20. Some of you are thinking, how am I going to fix such a big problem? Start with one person, start with one patient, but recognize that out of all of that opportunity that is before you, and if I use the word problem, 20% are really important. Let's work with those patients and their non-adherence. The other 80% important, but not as vitally important. So most of you that know me know that I always talk about 80-20. Happy to chat with any one of you later about the 80-20. Specifically in the Americas, in the Western part of the world, one of our biggest threat is perhaps excess and access. And that has to do with cost. Many people, many governments, many payers believe are focused on the cost of. Well, you know, focusing on the cost really isn't going to get us to the solution. We've been talking about trillions of dollars in healthcare losses and costs throughout the last decade and more. And has that caused any particular change? And I think the answer is no. So in the Western world, most patients are covered by some drug insurance, medication insurance plan. Those that are not covered by a medication insurance plan, they have different adherence issues altogether. And so whatever we look at the cost, maybe we should be looking at value. What is the value that we as pharmacists are offering to our clients, to our governments, to our societies? And then we need to change the conversation over to investment. What is the investment? And so, as I said a few seconds ago, we're talking about trillions of dollars. That hasn't worked. How do we change the narrative? How do we change the conversation in the Western world so that we've got investment and value as a result, and that will lead us to greater adherence? Thank you.
Thank you, Warren. And I particularly like the 80-20 rule. So thank you for sharing. And as Manjiri said, always enjoy your comments and wisdom. So thank you very much for sharing your region's perspective, Warren. Okay, so we'll move on to our next slide. Question 3, what is one improvement that can be implemented today in your region to improve medication adherence and communication? So we'll hand over to our final speakers. Firstly, we have Pascal, and Pascal, I might hand over to you to share your region's view. Thank you.
Okay, thank you. I would like first to thank the FIP for having me represent the Middle Eastern region. I would like to say that unfortunately, like my colleagues from other developing countries in the Middle Eastern regions, also here we have lots of weaknesses. And the problems resides mainly in the fact that everything is scattered. There is no one vision that really summarizes everything. So if I have to choose just one thing, I would choose to have a regional medication strategy. And this strategy will allow the appropriate access to the medication and the appropriate use of this medication among people. Because one of the problems is that we don't reach everybody. We don't reach all pharmacists whenever we do trainings. We don't reach all patients whenever we are offering the advice. And this is due to several problems that we have depending on the regions. We are talking about whether regions have hardship, whether regions have economic or political instabilities, or even whenever we're talking about regions that are at war. And you know that the Middle East have several countries that are currently at war. And these specific countries have their own specific problems. Now, if I want to talk about this medication strategy, well, I would like to just think about a strategy that would be evidence-based. And I would like to say that there are several research projects that were conducted during the last 20 years. And we have some information about how do people in the region think and why are patients sometimes non-adherent. So we have somehow some kind of context and background information that might allow us to go for a clearer evidence-based strategy. So what do I suggest? This strategy would be based on 7 axes. First, improving health coverage. And I know this is something that is very big that can be done in association with international instances such as the WHO. Improving access to high quality medication, because sometimes in some poor regions, you might have non-quality medications. You might have a substandard medication. So this is also something important. So the access to these good medications, and then you move to the optimization of trust in the healthcare system, because based also on evidence, it seems that there are a lot of patients who don't trust the healthcare system. They don't trust the pharmacist, they don't trust sometimes the physician and other. And this is a cultural issue that might be present in certain regions. So we would include the pharmacist among healthcare professionals who need to be trained. And of course, since we are pharmacists, the regional and the national association will have to work more on the training of these pharmacists, improving their soft skills, improving their clinical skills, because yes, we need it. Yes, sometimes some pharmacists in some region, particularly remote region, they just become sailor of drugs. They are just sailing. They don't really provide clinical advice anymore, unfortunately. So this has to be taken into account. In addition, the 5th axe would be working on a media strategy, whether we're talking the television or any other type of media, but particularly social media that harbors so much misinformation for pharmacists. And of course, the major example that we have is currently the misinformation about COVID vaccine and the vaccine hesitancies that we are encountering among people. Number 6 is establishing a digital system. Now, some countries in the region have this digital system, digital prescribing and digital also delivery of medication. And it might also encompass some reminders for patients to take their medication on time. And this is something that was tried in some countries, and it seems that it has really succeeded to improve adherence among patients. And finally, of course, a very special look at the countries where there are economic hardship. I take the example of Lebanon, my country, where we have a political and economic instability, and we have a very severe crisis. And the problem is not of the adherence is not only linked to the classical reasons, but it's also majorly linked to the fact that the patients are not finding their medications. So here, I think that the international instances and authorities, well, they have to do something. We don't have vaccines, we don't have chronic medications, we don't have antibiotics. It's a real situation that is becoming catastrophic, and something has to be done at that level. And thank you.
Thank you, Pascal. That was very, very informative, as I'm sure our audience would agree. So you've raised some very important points about access, around optimization of trust, and challenges to medication adherence. So thank you for sharing your region's thoughts. Okay, so last speaker is Mariette from Africa, and I welcome Mariette to share her view. Thank you.
Thank you so much, Sarah, and good afternoon, colleagues, and definitely a privilege to be part of this important discussion. So if I can identify one improvement that I could highlight to the African region, currently the issue that we have is it will be important for us, and I believe for every other country, to be able to track a single patient on a single healthcare platform, and to see when they, how is their adherence, what is their refill habit, what are clinical interventions. For instance, a diabetes patient, do they get their H1ABC test done on a 3-monthly interval? The blood pressure patient, do they have their blood pressure taken, on a monthly or a 2-monthly interval when they go and collect their medication, so that everything is available. So I definitely think that is an intervention that can be done, and I think the world is well away onto to something like this. So if I can add on to what Pascal just mentioned in terms of the COVID-19 vaccines, so in our country, and I believe around the world, it boils down to the same thing. There was a single platform for every patient, regardless whether you're an insured or an uninsured life, and if insured, where you were insured or from which region you are in the country, where you had to register. And this platform know exactly who you are, where you got this vaccine, and it had the ability to follow up, firstly to remind you of your appointment, but then secondly, following vaccination, that initial communication on what side effects you might experience, and then maybe 3 or 7 days later, if there's any severe adverse drug reactions, what to do and where to contact. So I think in essence, that is where I think we should be going, because that will be, only then we will be able to see one single version of the truth when we look at a patient and to their medication experiences. Thank you.
Thank you, Mariette. That concludes our roundtable. I might hand over to Lars before we ask you all about our final messages. Thank you.
Thank you so very much, Sarah, and thank you, colleagues. Thank you, dear panelists. What we are overwhelmingly aware of is that this problem is not solved in one digital event of 90 minutes. And we are overwhelmed with all the work our experts have dedicated to develop their answers and time spent in advance for this event, as well as for the presentations. I think we have had such fantastic presentations from all panelists and regional colleagues. And for all of you who are attending this event, we will compile all the answers from our experts, which will be sent to you all later, as in this event, we are unable to have all our regional experts responding to every questions. I want now our panelists to turn on their cameras and get ready to deliver one key message to all our viewers all around the world. We have several questions in the Q&A box and some narratives that have been written by you all, which explains your responses regionally to the questions sent to you. I think we need more global events where we have and can learn and share from each other. What is clear is that trust is very important, and we need to reflect over what is building trust, how we communicate, how we see the patient as an equal partner in his or her treatment. And of course, we also have the excellent examples from Pfizer, which is one of our corporate partners in this endeavor, about how we can improve adherence and how we can optimize the investment in health by making sure a patient gets all the benefits from the prescribed therapy. As such, I would suggest that we will pull together another meeting where we will draw together a commitment from each of our regions, great examples, great showcasing. So let us now ask our panelists for their take-home messages. Sarah, over to you.
Thank you, Lars. All right, I might ask in order that you're presented on the screen. So first we have Tamara. If Tamara, would you mind sharing your take-home?
Yeah, promoting patient knowledge of the medication from the community pharmacies.
Thank you, Tamara. And next we have Lauren.
I guess I'll refer to my 80-20 in the sense that trillions of dollars, millions of people, where do we focus? How do we focus? And so we can't, the story goes, how do you eat an elephant? One bite at a time. And so the same thing here, big problem, opportunity with your clients today, Start with one.
One bite at a time. Thank you, Warren. All right, we have Pascal.
Yes, I would like just to say that we should be working together. Sometimes we work in silos and we don't really collaborate enough. And this is, I think, one of the major issues that are necessary in order to really have a real strategic thinking and to be able to reach some plans that could be executed. Thank you.
Thank you. Next, we have Marianne.
Thank you, Sarah. From my side, I would say that both governments as well as pharmacies must ensure that there is an enabling environment and a manageable workload to ensure quality services to each patient. Thank you.
Thank you, Marianne. Next, we have Manjiri.
Thanks, Sarah. So we all know medicines don't work if the patients don't take them. So in Southeast Asian region, we need to identify this as a problem and formulate a policy to step up, upskill the pharmacists to improve the medication adherence in the community. Pharmacists are the drivers of the community health. And so we need to work more on it and improve the adherence.
Thank you, Manjiri. And lastly, we have Victoria.
So there is extensive evidence of the positive impact that pharmacies have on medication adherence management. We know that many pharmacies, community pharmacies, are already providing these services, and we need to develop implementation programs so we can scale up these interventions and help them implement.
Thank you, everyone. I'll hand back over to Lars.
Thank you so very much, all of you. One reflection I got that the ways we make meaning in communications are more confounding perhaps today than ever. Quarantine and the rise of hybrid everything over the last year has meant even more digital interaction, even with our patients, than we already had, and made perhaps the opening questions even more urgent than before. And traditional respect has always been based on the physical signals we exchange between persons, and each personal interaction generates positive signals that our brains have come to understand unconsciously through hundreds of thousands of years of evolutionary training. But today, many of our interactions also lack the visible signals for making meaning. So showing trust and emotional intelligence in a hybrid world is also something to reflect over. And perhaps reading carefully is the new listening, and writing clearly is the new empathy. And don't forget that the phone call sometimes is worth more than 1,000 emails. So I would like to thank our distinguished panelists and the presentators for sharing their experience, as well as providing us with wise recommendations based on their research and the FIP reports and toolkits, and most valuable input and advice from our colleagues at Pfizer as well. I would like all panelists to join me in thanking the FIP team for their support and for managing all the interactions, and the Pfizer team who have shared their experiences and expertise how to improve and optimize adherence. We have to work in partnership. Adherence is very important, as a medicine is an investment in health. We all have the responsibility to improve adherence. I want to thank our regional colleagues for staying up late in the night or starting up very early in the day, and for all your hard work. And of course, my colleague and co-moderator Sarah for her great support today. Finally, and honestly, I advise you all to become, if you already are not a member, become a member of FIP. It is probably the best investment you can ever make. Thank you so very much, all of you. We will run more events on this and see you soon again. Thank you so very much and goodbye.